A local biotech company may have found a way to help veterans who have PTSD and other mental health issues. Our Kelly Cowan is here now to tell us all about it. Quite a story, Kel.
Good morning to you. It really is. And there's been quite a trend, a growing trend among the veteran community to travel overseas to take part in psychedelic-assisted therapies. And the reason why is that those therapies have shown a lot of promise in treating PTSD. Another reason why they need to go overseas is that the drugs here are illegal, but there's a strong push to change that. And one local company who's at the forefront of research. One local biotech company hopes to be on the verge of a mental health breakthrough.
It's a treatment option like nothing we've seen.
PhD scientists Jackie Von Salm and Chris Witowski are the co-founders of Solera, a startup that's rebooting psychedelic compounds like LSD, MDMA, and psilocybin, also known as magic mushrooms, by creating their own non-hallucinogenic brand of psychedelics.
These drugs have been around for a very long time. And as we work on them to create a more medical pathway and really have these medications be available to patients, we want to make sure there's not this maybe negative stigma associated with it. We also want to make sure a patient's not fearful of even trying the medication.
Psychedelics have been used for medicinal purposes for millennia. But in the mid-20th century, scientific exploration exploded thanks to a pair of Harvard scientists' studies. Research, though, ground to a halt in the 1970s and 80s. The U.S. government cracked down on the drugs, which had become closely associated with hippie culture and drug abuse. Psychedelics like LSD and psilocybin were classified as Schedule I drugs, meaning federal regulators defined them as having no accepted medical use because of their potential for abuse. According to Witowski and Von Salm, that blacklisted drugs that had shown promise in effectively treating mental illness.
It's not a problem that's going away, it's actually getting worse. And if we don't tap into the potential that these have, I mean, there's literally just innovation and promise sitting on the sidelines.
But a new champion for the drugs has emerged from an unexpected corner.
On a daily basis, I'm speaking to veterans who have experienced psychedelic-assisted therapy, primarily outside this country, and it's been a life-saving experience with the medication they've received.
For nearly a decade, retired Lieutenant General Martin Steele has been one of the loudest voices advocating for medical and drug reform in response to rising veteran suicides. The Office of Veterans Affairs estimates 17 veterans die by suicide on a daily basis in the U.S. Outside researchers, though, say that number excludes overdose deaths, and they suggest the number could be closer to 44 a day. Steele says government restrictions placed on certain treatments are failing our veteran community.
My sense was that SSRIs and the continuation of what I pejoratively said, a bag of drugs being distributed to our veterans at VAs across the country was not going to answer the requirements for their mental health issues.
The Vietnam veteran has made it his mission to convince lawmakers to reclassify certain psychedelics in order to promote research into potentially life-altering medications.
Schedule I research is so onerous and so restrictive. The fact that we can move it to Schedule II just opens the floodgates of people to be able to do the research like what we have here with Chris and Jackie.
The Solera founders say their early research has shown myriad benefits, and their drugs work in a fraction of the time required by current treatments for depression.
And they work within minutes for depression, for anxiety, for addiction disorders. And they do this without hallucinations.
Meanwhile, on Capitol Hill, Steele's advocacy has led to the Breakthrough Therapy Act. The bipartisan bill, sponsored by Republican Senator Rand Paul and Democratic Senator Cory Booker, would remove some of the regulatory hurdles.
When someone calls me, who's in the Veteran Mental Health Leadership Coalition, which is on a daily basis, and says, "Thank you, General, for saving my life," that means all the difference in the world.